Now, South Africa has welcomed the International Court of Justice's resolution to impose further provisional measures on Israel. The recent measures are aimed at guaranteeing the smooth delivery of humanitarian aid into the Gaza Strip. For more on this discussion, we're now joined by South African Healthcare Workers for Palestine organizer, Dr Marcelia Theron. Dr. Theron, thank you so much for your time and once again joining us right here on Newsfeed PM. Now, Healthcare Workers for Palestine in SA recently had talks looking into medical ethics and human rights violations in occupied Palestine. Just tell us more about these discussions and these conversations that took place.
Right, so thank you for having me. Our talks recently were aimed at looking at the role of ethics in healthcare, including what is expected of healthcare workers morally and ethically in their conduct, as well as how those values have recently been violated in occupied Palestine. I wanted to bring across the point with the most recent seminar that what we do as healthcare workers cannot be separated from the advocacy for basic human rights. And in the World Medical Association's International Code of Medical Ethics, it does state that the physician must support fair and equitable provision of health care, and that includes addressing inequities in health and care, as well as violations of the rights of both patients and health professionals. So just to name a few examples of such violations, which we did delve into in the talk, we touched on the attacks on healthcare workers and facilities, the targeting of healthcare facilities as part of a process of destroying the necessities for life in the area, and through doing that, maximizing the impact of loss of life. Beyond that, there's also the blatant violations, such as the desecration and theft of Palestinian corpses that has allegedly taken place, and some of those corpses being returned allegedly missing organs, so as to raise questions as whether there may be illegal organ harvesting taking place. Beyond that, there's also the use of famine in war, and as you guys are aware with the most recent court ruling, the famine is of such great concern that the World Court has ordered Israel to allow and facilitate humanitarian aid into the area as a matter of urgency.
So, Dr. Theron, then with that said, what's your organization's reaction to the decision taken by the top UN court regarding Israel and Gaza recently?
So, myself and my organization, we do see it as a necessary step, but we do not feel that it will do enough, given that Israel has shown previously that it will not comply with the International Court of Justice's orders to avoid loss of life. In fact, Israel has shown blatant disregard to previous orders where it was clearly stated that they must do everything in their power to prevent loss of life. The recent flower massacre is a good example of their abuse. So we are, to some extent, of the opinion that the aid and humanitarian provisions should perhaps not be overseen by Israel anymore, given how they have handled the situation, but rather be taken over by humanitarian agencies.
I mean, with what you know from your colleagues who are on the ground, when they explain the situation in Gaza, how dire is the humanitarian situation currently?
It is absolutely devastating, absolutely dire. At the moment, there are issues of famine, concern for catastrophic food insecurity that is likely to be faced by at least 1.1 million of the inhabitants of Gaza. The recent storming of Al-Shifa Hospital, as I mentioned earlier, that just speaks to the deliberate desecration and destruction of healthcare facilities that could in any way help to alleviate the famine and the scale of the health crisis there. So far, we are sitting at more than 32,000 killed, more than 14,000 of which are children, and many, many more injured. So it is an absolutely critical situation.
So beyond the immediate aid access, what are the long-term solutions needed in order to address this humanitarian crisis in Gaza?
So from our perspective, the most crucial intervention that South Africans and countries globally can do is to enforce a strict boycott, divestment and sanctions policy, to cut ties with Israel as a state, essentially, and to not enable Israel in their actions further by engaging in any form of trade, political, economic, academic, research, cultural engagement whatsoever any further, because any engagement enables them in their actions. So it worked for South Africa in our past, and we have seen the results of boycott, divestment and sanctions, and we feel that it is absolutely crucial that it happen now as well.
Why do you believe it's taking so long for such boycotts to take place and for Israel to give this continuous heinous crimes that they are continuing on the people of Palestine?
Well, it is my view that Israel has been to some extent enabled through its support received by the US. So, and this is my take on it, but the US has vetoed numerous resolutions for ceasefire and has continued to blatantly provide financial and military aid in the actions taken by Israel. So that is part of the problem. But I will say we are seeing a shift, and some nations such as Spain, Belgium and Ireland have all started to impose sanctions, thankfully. So I don't think that we need to be hesitant to bring momentum from our side as South Africans on that front as well.
Speaking of that momentum, what role is your organization playing in regards to humanitarian aid?
So the role of Healthcare Workers for Palestine is essentially that we advocate as best we can for Palestinians and their rights. We try to raise awareness. We try to push the BDS movement forward, and we also have tried fundraising in collaboration with organizations enabled to do so, such as the Palestinian Solidarity Alliance, among many others. And we've been liaising with other pro-Palestinian organizations to try and facilitate change and awareness in the population.
All right, Dr. Theron, always a pleasure having you on the show. Thank you so much for your time.